Health Spotlight, presented by Community Health Network.
Let's welcome in WISH TV medical expert and former U.S. Surgeon General Dr. Jerome Adams. And right to the report earlier this week from the current Surgeon General. He says social media is a profound risk of harm to the mental health of teenagers. There's some strong language in Dr. Murthy's advisory. How dangerous is social media for teens?
Well, we know that we are in the midst of a mental health crisis nationally, and it's particularly pronounced for our young people. What we've found, and what Dr. Murthy points out in that study, is that social media is a big precipitant of these mental health issues. If you spend more than 3 hours on social media as a young person every day, you are twice as likely to have anxiety and depressive symptoms. And they've actually found that if you decrease your social media usage, it can significantly lower your depression and anxiety symptoms. So this is a factor that is really having an impact on our youth. It's both content. They're being exposed to sexual content, to violent content, but also being pressured to keep up with the Joneses, if you will. And it's also addictive behaviors, problematic usage. Young people say they can't stop using.
So knowing this, should social media use be part of the discussion with pediatricians?
Absolutely. And when you're Surgeon General, you raise up issues that are trending in the wrong direction, but you also try to give people practical tips. If you look at the Surgeon General's report, there are tips for families, tips for doctors, tips for technology folks. And yes, pediatricians should be screening children for social media usage, but we should also be advising families to create tech-free zones and encourage children to foster in-person relationships. As adults, we should model responsible social media behavior, and we should teach kids about technology and empower them to be responsible online users. I often say this is a tool, just like a hammer. It can help you build a house or it can harm you. We want children to be able to use social media in a productive way.
Okay, thanks for that. I do want to move quickly to COVID. A new study out this week says 1 in every 10 people who got COVID from Omicron has developed long COVID. What can we learn from that study?
Well, interesting thing about that study in terms of context. Prior to Omicron, it was about 33%, almost 1 in 3 people were displaying symptoms of long COVID. So this study shows us that Omicron actually is not having as a profound effect on us as previous variants were. But still, 1 in 10 people, that's pretty troubling. They also identified 10 to 12 symptoms that doctors could look for so that you could get an official diagnosis. We need more research into how to treat it. And what I would say as a doctor is the best thing you can do is to make sure you're up to date on your vaccinations, because that's been correlated with a lower chance of you getting long COVID if and when you do get infected.
All right, of course, this is Indy 500 weekend. Now, as we've already witnessed, it's too late for the crowds at Carb Day, but it's worth reminding about staying properly hydrated and wearing sunscreen.
Well, I always tell people to enjoy themselves, but enjoy themselves safely and in moderation. And it's not too late for those people at Carb Day. We want to make sure Memorial Day weekend, if we're going to drink, we're going to drink responsibly. We're not going to drink and drive. Plenty of sunscreen, as you mentioned. Stay hydrated. Don't eat food that's been sitting out for a long time. We don't want food poisoning. We want you to have fun, but we want you to be safe.
Solid advice. Have a great weekend. Thanks for joining us.
Thank you. You too. I'll see you at the track.
All right. Sounds great.